So, hello everyone, and very good afternoon, all of you. I'd like to welcome you all for the iTalks webinar or by Mero Eye Academy on the session 129. Today we are going to have a session on research project management. Before beginning to the session, I'd like to give a short introduction to our today delegates. As a speaking delegates, we have Dr. Prakash Paudel, and he'll be giving talks on research project management, and he is research officer at Brien Holden Foundation, Sydney, Australia, and Adjunct senior lecturer at School of Optometry and Vision Science, University of New South Wales, Sydney, Australia. So without any further delay, I'd like to welcome and over the screen to Dr. Prakash Paudel. Over to you, sir.
All right. Okay. Thank you, Kapil and Mero Eye team for this wonderful opportunity. And I would just like to share my slide. Just give a moment. Where is the slide button?
Can you see it, sir?
Yeah, I'm just having difficulty to share. Yeah, it's been difficult to share me because I am not able to get the share button here.
Okay.
I can see that. Yeah. All right. Yep.
Yeah. All right. It's been shared. All right. You can see it here.
Okay then. Yes. Thank you again, Kapil, for this opportunity. And today I'm basically presenting my experience on school and population-based research project management in Vietnam. So following my PhD, I started to work as a research officer in the Brien Holden Foundations, and I had privilege to manage the research projects that were conducted as a part of Vietnam, Australia Vision Support Program that is called as BABUS. And the BABUS program was implemented from July 2011 to December 2013 in 3 districts of Bà Rịa Vũng Tàu province in Vietnam. And this program was funded by the Department of Foreign Affairs and Trade, Australian government, and included eye care professionals training for refractive error and its service capacity development, vision centers development, outreach, eye care activities, teachers training for the school eye health. And on a research part, the projects included refractive error study, CAP, knowledge attitude practice studies, evaluation of the school health promotion, and community health education and health service research. So the Vietnam-Australia Vision Support Program, which ended in 2013, but the BRVT Provincial Eye Center with the Provincial Department of Health, they continued the school eye health program in the province. And after 7 years of the program implementation, we have recently completed a study which is about evaluating the effectiveness of this teacher-led school-based eye health program in Vietnam. And this evaluation project was supported by the Alliance Club International Foundations. And this project is also being conducted in Tanzania. So before talking about the research project management, let me first talk about the research projects that I completed as a principal investigator in Vietnam, and that includes refractive error in school children, that is risk study in 2011, and the assessment of teachers' accuracy on conducting vision screening, which was conducted again in 2011. And the third one is knowledge, attitudes, and practices of adults in communities towards the eye health, which was conducted in 2012. And we also had two health promotion and intervention study. So the fourth project was evaluating the effect of school eye health promotion in children's eye health literacy. And the fifth project was related to evaluating the effects of a community-based eye health education in eye health literacy of adults. And as I mentioned earlier, in the last 2 years, I also had an opportunity to conduct a follow-up research project in Vietnam, which is aimed to evaluate the effectiveness of teacher-led school-based eye health program. And that was started in 2019, and we have just completed data collection in mid 2021. That means the end of last month. And from the research projects conducted in 2013, we published this first paper on refractive error in school children. We reported that the prevalence of refractive error was 21.4%, and myopia prevalence of 20.4%. And we will be soon reporting the current refractive error rates in 2020. As I already mentioned, that we also had a follow-up study after 7 years of that initial program implementation in 2011 and 13. So the second study that we published in a journal called Ophthalmic Epidemiology, as we train as part of that broader VAVSP program, that Vietnam Australia Vision Support Program, we trained 97 teachers from 56 secondary schools in the BRVT province in 2011 and 13 to conduct eye health screenings in school children. So we evaluate the teachers' accuracy on conducting vision screening after a brief training, and we found that the trained teachers in Vietnam had reasonably good accuracy with 86.7% sensitivity and 95.7% specificity on detecting children with vision impairment. And we are now again re-evaluating the school vision screening conducted by teachers in the same schools, so that we can determine the teachers' rate of visual acuity assessment accuracy after 7 years, and report how well they are doing in terms of vision screening in the schools. As part of this project, we will also be reporting the barriers and facilitators of the teacher-led school-based eye health program. In our third project, we conducted a knowledge, attitudes, and practices study in rural and urban communities in 2012, and reported the health literacy rates of adult population The results reveal that about 50% of population were aware of red eye, presbyopia, and refractive error. However, the awareness and knowledge related to cataract, diabetic retinopathy, and glaucoma was quite low. Then it was the first time we produced a protocol and published a novel paper in a health promotion international journal that included pre and post cap intervention studies assessing the effect of school eye health promotion on children's eye health literacy in Vietnam. After a baseline study, we implemented 4 different school health promotion intervention. That is an oral talk by an ophthalmologist at the school's, posters display at the school premises, distribution of brochures, leaflets, and stickers or decals in the school bags, and lastly, conducting primary eye care and faucet trainings to teachers, and conducting school vision screening. So with this study, we found that eye health knowledge in general increased by 10 to 20%. And after 6 months of health intervention and promotion at schools, we found the rates of eye examination and spectacle wear in school children also increased significantly. And this particular paper is widely used in the WHO papers as well, and they have been reporting this as a main primary papers that has primarily used pre and post intervention method to evaluate the eye health literacy of school children after conducting the school eye health promotion in the schools. So lastly, I managed to publish a community-based CAP research project's findings in May this year in the International Journal of Health Promotion and Education. We conducted pre and post health intervention CAP studies and assessed the effect of a community-based health education intervention on eye health literacy of adults in Vietnam. So the community health education interventions included community presentation on eye health in health centers, loudspeaker broadcasting of eye health messages, eye health education poster displays at the schools, markets, and health centers. And lastly, the distribution of eye health information brochures in all households of the intervention communities. So a repeat survey was conducted after 6 months of conducting this health education intervention, and we found that the intervention communities showed a significantly greater awareness and knowledge compared to control group. And in particular, red eye and cataract health literacy improved significantly in the intervention communities. And number of eye examination visits also increased in the intervention communities compared to the control communes. Now, with this background that I was engaged in the projects in Vietnam a couple of years ago, like it's already been 7 years. And now at this stage, again, I have that opportunity to re-evaluate that program, that school-based program, by conducting a research project. So we are at the stage of analyzing the data and reporting the results. And very soon we'll be reporting those findings in a proper ophthalmic journal. Now, with that background, that experience I had in project management, research project management. So I would now like to talk about the research project management from my learnings of that managing and publishing research projects in Vietnam. So project management is the application of processes, methods, skills, knowledge, and experience to achieve specific project objectives according to the project acceptance criteria within the agreed parameters. So project management has final deliverables that are constrained to a finite time scale and budget. And there are several associated issues and factors that we need to be accountable for a successful project management. There are broadly 4 stages of a research project management, that is initiation, planning, execution, and closure. So if we look into the initiation phase basically include designing a project scope with a well-defined research protocol, organizing the project's meeting, identifying the project team and local partner or stakeholders, and engaging them in the project, and also preparing the study sampling and sample size and design of the study, and also about the field procedures, listing out the documentation and deliverables that is required for the project, and also identifying about the timeline and deadlines, and conducting budget planning for the research activities. So this is how we come up with an idea of initiating a project, and we get into the planning stage. In the next stage is a planning stage where we create a work breakdown structures. Basically, as you can see here in the pictures, like we have a aim, and we could have more than one aim. So within an aim, then what is the expected outcome? So if you say that as a deliverable 1 or deliverable 2, 3, and those are the outcomes. And to achieve those outcomes, what are the tasks that we need to perform in the real field? So we have to have that breakdown of the structures so that we can narrow down our results addressing the particular objectives or aims that we have. And after having this clear idea about the aim and objectives and the tasks and activities that we need to complete to come up with or to address those objectives, we should have a clear schedule of the project activities. So we need to develop a schedule. And also we have to assign defined roles and responsibilities to different field team members, because as part of the research project, it is not only engaging 1 or 2 persons. So we do have principal investigators and other co-investigators who are much more involved from the beginning stage, from the initial stage, at the stage of writing a protocol or proposal and developing a real protocol or procedures of this study. Then there comes different roles for data collectors. That can be an optometrist or ophthalmologist or ophthalmic assistants or other eye care cadres who can play their roles and responsibilities in terms of visiting the fields in the schools and in the communities, because I'm talking more from the school and community-based perspective. So I am just saying that if we are implementing this project, then definitely the assigned roles and responsibilities for ophthalmologists or an optometrist or any ophthalmic eye care cadres. It should be well defined, and then they have their responsibility. They have that routines in the field, so that they are liable to report someone as a principal investigator or a team manager during that field visits. And definitely, as we plan the activities, research tasks, we should have a clear-cut calculation of budget for each of those tasks and activities, because there involves different stages of implementations. And if we talk about implementing by visiting of community, definitely we have to work on the per diem rates and all the other logistics and transportation and that sort of thing. So that has to be calculated in advance during the planning stage, so that we have a bigger picture, a good idea of what would be the total amount, total fund required for this project. Or if you say, if this is a funded project, then there is a particular fund provided by a funder for this project, then within that specified budget, we have to conduct our activities. So this planning is very important, because without having a plan, it will be a mess kind of thing. In addition to this, we should develop a communication plan as well. It is not all on the hand of the principal investigators or co-investigators, because the idea, the general idea and the way the results has to be put together in a report or a publications, those ideas has to be shared to the other responsible field members as well, because we need to have a communication plan that's saying these are the outcomes that we are looking from this data collection activities in the field. Then they prepare from their perspective and the roles and responsibilities we have given. They walk out within that frame, and then if there are any difficulties, that communication can be they can report to the manager or the supervisor, field supervisor. So that communication plan has to be well set up in advance. So it also comes under the planning stage. So in general, we have to have a complete project plan and sign off the project. What I would say is, even in the planning stage, we have the partners' roles and responsibilities. If we are conducting a project such as that I have conducted in Vietnam, because Brien Holden Foundation's office in international office in Sydney, liaising with the Brien Holden Foundation office in Vietnam, and they again liaising with the local eye hospital, that is Baria Vung Tau Provincial Eye Institute in Baria Vung Tau province. So that liaison, that communications has to happen in between the partners and the stakeholders, so that everyone understand the entire process of the research project. And more importantly, it is not only should be looked from the perspective of finishing the project, completing the project. It is also about giving the on-hand experience or learnings to the country workers or health professionals who can just had that experience of learning something from the international NGOs and from the experts, global experts, or within the country experts, if they are available. We can have those partners organizations to make the project happen in the country. So from that aspect, also, I would say in the planning stage, we should have that clear communication plan with the partners and the stakeholders, and we should provide them, we should engage them in the planning process as well. So if we talk about the next stage, about the implementation stage, I would say we have a bigger role. Is planned. We have to have a preparation, well preparation on time, on given timelines, because we would have a timeline as well that is quite well reflected by GNAT chart. GNAT chart gives all the deliverables that we intended to get after completing the project. So that timelines can be just reflected in the graph, and then we can just work on that if we need to revise as well. So as in terms of implementations, when we have to deliver these projects, then there comes ethics applications, which is very important. And as an international organizations which is conducting research projects in different countries, we are also liable to have an ethics clearance from the organizations where you are working. So basically, in these projects that I have handled in Vietnam, we have received ethics applications from the ethics committee at University of New South Wales. And that alone is not sufficient. So we need to get an ethical clearance from the country itself as well. And we have to apply in the ethics committees in the institution in the project country. After having that ethical clearance, we have also clarified about the data transfer as well, because some of the countries are very strict in terms of providing data from the country to a third country. So that has to be worked out during the ethics application process. That is what we do in most of our international programs. And having the ethics clearance, we plan the training session for a project delivery team in the fields. For that, principal investigator or co-investigators just travel to the project country, or if it is not feasible to travel, such as in this situation, like currently there is a pandemic situation happening in all around the world. So it's really difficult to travel. Then in such case, we can just organize that. We can have an arrangement with the partner organizations from the co-investigator from the country, or the responsible person from the institution in the project country. They can be part of the planning process, and we can deliver that training through online by a video conference as well, because it's more about giving all the information, detailed informations about the protocol and the procedures, the consent process, and data collections, and how data are being collected. That is really important. So that detailed training that can be arranged in country, in one of the seminar hall of the partner organizations, or if it is not feasible to do that, then definitely it can be delivered through a video conferencing. And then rest of the training, that half of the training can be organized by the local research supervisors or local research managers who is responsible for this project. He can be part of that process as well. And usually in school and population-based programs, we can just directly get into the field in the communities, because we should be able to understand whether the protocol, that procedures we have, the consent process that we have, whether that works quite well. If it is not, then we have to rethink, remodify, and even about the procedures, that clinical procedures and data entry sort of things that need to be very clear to the field members. That is why that pilot training in the fields, in fact, visiting a school or a community is really important to deliver this kind of project like school-based and population-based research projects. Then after having that pilot training, then the field member will have a good understanding about the entire process, and if there are any technical difficulties that can be addressed in advance. And also we can make an adjustment in the survey questionnaires or in the survey record forms that can be modified if we feel that there is something missing or something has to be added or built in the protocol. Then that can be worked out after the pilot training. After the pilot training, or say pre-testing, then we have a main data collection visits. That field visits, planning, data collection, and all the data entry process and procedures that should be conducted as mentioned in the protocols. And at the end of each day, if the field members meet together and then just look into the way they worked on that day, the way they collected data, and the data they entered into the system. Basically, these days, it's not only in the record forms. We do have data entry through an app and that can be sent into the server, and the database can be saved somewhere in the server, and then we can access remotely as well. So all that whole day activities can be just summarized, and if anything that is important to be discussed during that meeting, that can be discussed, and that can be corrected for the next day as well. And there should be a complete progress reporting documents after each field visits. And usually the in-country investigator or leader of the field members, they report principal investigator about the data being collected on the day, and doing or conducting a daily data quality check, so that even I can check remotely if that is the data are entered from the app and sent into the server. I can have that access of that database from here and just check it whether that is correct. If there are any errors, the next day that can be corrected. So the process, it is not only involves in the field. In the other part, the principal investigator or the person who is managing the project from the overseas, they can just monitor the project and look into the data and the quality of data coming from the project. And yes, this is really important. So this is all about the delivery of the project in the field. And basically, when we are delivering this project in the field, there comes important role of human resource, that field members. So basically, in any projects, definitely we liaise with the local partners and with experienced research or clinical staff from the hospitals. And at least even with the international projects such as I have managed, we have at least one local study co-investigator, so that he is involved through the entire process from the study design to the data analysis and writing and publishing stage as well. So that co-investigator from the project country can be one of the author on that publications. So, and this inclusion also provides the opportunity and exposure to the local institutions and researchers for future projects, so that they learn the entire process and they can conduct the projects on their own in the futures as well. And this provides the on-hand training and exposure and help the local research capacity development. In particular with the equipments, there are different options to get the equipment. We can just hire the equipments, or we can just get the equipments from the hospitals if they are available. If the hospital is doing the outreach activities, there can be a spare of the equipment. But in case if it is not that, and that equipment is funded by the project, then we can initiate that purchase process from the local suppliers, and also seek for the import options if it is not available in the country, and that has to be supplied from overseas. All that has to be looked over by a research administrative person. We can just work on that part. During this period of time, as international prevention, IAPV basically, and they have IAPV valued suppliers, and they have a dedicated website where there are different suppliers giving the details of the equipment that is available and the course that is available through that web page as well. So it is now very easy for any country who can directly access to that web page and ask for the course, and that can be purchased through that process as well. And as I mentioned, in terms of data record forms and consent forms, which is really important part of the research projects, we definitely should have record prints to take in the field. And if we are also relying on particular database, such as like RedCap database, definitely there is a RedCap app that can be downloaded in the iPhone or Android phone or iPad. And these are really easy way of entering the data, and that immediately comes into the server and immediately available to read those data if the data is correctly entered. So as I mentioned while talking about the equipment, and there are different other administrative costs that involves in this project management, such as these ethics applications, translation of documents, transportations, dealing with per diem salaries or venue cost, or some project logistic costs that has to be handled with the administrative officer. And any feedback from the local researcher or a local key contact persons, if they are involved, then that will be a good benefit, because a local administrative officer is viable options to have this kind of project. When you are handling a project from a third country or overseas countries, such as like Brien Holden Foundation conducting research projects in the Asia Pacifics or in Africa, that is what we are doing, and I'm doing as well. And there are different problems that we have to face during those project implementation phase. And basically communication is key. Communication is really important to get in success for this. So communication with the local research team and staff is really important, and we should have that on a weekly basis or at least a fortnightly basis. That communication, if it happens, then that keeps everything on track. And we can also experience some delays in ethics approval. It depends upon different country requirements. So we often experience such kind of delays. especially when we have a multi-country project, such as the one project that I have been managing at the moment. We are managing in 3 different countries from 3 different WHO regions. So, and it involves entire 4 to 6 months to get ethics approval from all the countries. So it is definitely time consuming from that aspect, and research permit is also important if an international investigator is involved in the project. All the they don't just allow to travel in the country, so we have to get a research permit travel for such purpose. And as I already said, like equipment purchase can be a problem due to import issues or not having a local suppliers to supply such equipment, such artificial intelligence equipment, which is now a part of the research projects that is inbuilt in the research projects these days. So I already mentioned about the data transfer policies is different in different countries. That could be an issue. And another issue is the compliance issues. Compliance issues in the sense like there is a child safeguarding course or anti-terrorism check, and there are some other policies that has to be looked into, checked in, such as exploitation and sexual harassment, the travel and insurance. These are some common problems that has to be well addressed. These compliance issues has to be handled quite well in such kind of project. And to solve those problems, so we should have a communications, regular communications, and regular update about the progress that has happened in the field. And also sometimes we may have to adapt with some urgent or unconditional or incidental situations, and we should be flexible with time and also with the alternative resources that often is experienced when you are doing such a projects in the international level in different countries, especially when it is a multi-country project. So in such cases, sometimes we have to ensure that without changing anything in the protocol or procedures, without the permission of ethics committee, that should be ensured. Even we have to make a little bit of alternative approach that should be kept in mind, because we should inform that to the ethics committee, so ethics committee approves with that alternative approach as well. And as I said, data collection methods, that paper record forms or online forms as a Google form, SurveyMonkey, Qualtrics, Microsoft Access, RedCap, these are quite common online record forms, or in forms of app also these are available, so that we also get in data entry and quality check opportunity on time, as I earlier mentioned about that quality check, which should be a part of the everyday routine procedure. At the end of the day during the data collections, that quality check has to be happen so that we can continue with the data collection. And this data definitely can be stored in a database server like RedCap database, where if you use that RedCap app, then definitely that is the process. And some can be just used in some qualitative data can be just stored in the NBO. And usually we just keep those data for a certain period of time, depending on the ethics committee in the countries. And in terms of after having those data collections, then having a data quality check and ensuring everything is correct, then we look into the next stage of data analysis and planning. So we do have an options which is quite popular, that SPSS and SAS statistical software are quite commonly used. And for qualitative data management, NVivo is the most popular system that we have been using. And the data analysis can be planned in the beginning stage when we have an objective and we have a given task and what would be the outcome. Then at that stage also we can just plan what statistical analysis has to happen to get that, to address that objective. And usually we use all those statistical analysis approach through different statistical software, and also report those in forms of graphs and diagrams, which are usually better in Excel rather than in the SPSS. Then comes the stage of report writing and publications. Reports generally are prepared for the funding agencies, ministries of health, and the relevant departments in the project countries, and even for the partner non-governmental organizations who partners with us in this project. So the report is not always essential, but it is often required if any international NGOs is conducting a research in a country. Then we are obliged to prepare a report for them as well. And the most exciting part of this study phase is about publishing, because if we publish the work that we do, then we can say that yes, the work has been done. If we are not able to produce any articles, any publications, then it's not known that whether that project has been done in any stage in the past. So it's really important to have a publication. That's the reason I mentioned that during that project period in Vietnam, though it was conducted in 2011 to 2013, from every project, there is one paper in an international peer-reviewed journal. So that should be the spirit, so that you have that credit and recognitions from the project that you conduct as well. So sometimes some research works are still relevant, publishing even after 5 or 10 years. This is particularly true for some novel methodologies, or when you are reporting some intervention outcome. In such case, even if you don't have time for certain years, it can be reported at some stage as well, because that would be still relevant because of the methodology. And that is what it happened in my case, in that the 5th paper, which was recently published, but it was conducted long ago, that's 7 years ago, but it was reporting about the interventions, like health education interventions. So what was the outcome of that intervention? So that was really important to bring that, and that sort of research is novel and it's not published, it's not available. Then it becomes very important to have that sort of publications as well. And yes, and the publications are also the good source of for future studies, because usually the publications also identify what were the limitations and the recommendations that we can conduct another studies to address the particular problems or concerns that is raised by the paper. So it's this research report writing and publications or a result dissemination workshop kind of thing is a fourth stage of the research project management. That is a closer stage that we are closing the project. So in such case, what you are doing is you are writing a report, writing a journal paper, and also preparing a PowerPoint presentations to present to the stakeholders, those who were involved in the project from the particular country, that project country. So as you can see there here, we did a project dissemination workshop in this one. This picture is particularly from Cambodia, from a different project. We presented the findings to the stakeholders who were from different NGOs and even from the ministries as well. And we often present papers in the scientific conferences. Sometimes if the study gives a certain message, we can also disseminate that message through local newspapers and also through social medias. That is a very important steps in the fourth stage of this research project management. That is a closer stage. We are just doing this kind of activities. So in the future plan, then we come, as I said, from the recommendations, we can have a future plan about having another research or a follow-up research or a new health service research. And then we can have a plan and write a research proposals, put in grants application. And if we are successful in getting a grant, or if someone funds for the project, then again, we can just keep moving ahead with the new project journey. So that is what it happened with this Bhavas projects, which were conducted in 2011 and 2013. 7 years, we had an opportunity to re-evaluate that program that was implemented then. So yeah, that future plan is really important. So if I have to give a brief information at this stage, what I'm engaged in is mainly in evaluating the effectiveness of teacher-led school-based eye health programs in Vietnam, which is after 7 years. And also we are doing in Tanzania after 5 years. Because in Tanzania, we also had a school eye health program in 2013 to 2016. So what next? So after having this closure, after having publications, reports, then we try to advocate with the government, with the NGOs, and try to address the problems by asking them to make policy changes and implement those recommendations that we offer from the project. And also, if there are some uncertainties, there definitely will be more things to do and more studies to do in the future. And then just keep going with the momentum and then achieve the milestone. That is what the entire concept of the research project management is. So you have from the initiation stage to the closer stage, that there goes a much more activities, such a in-depth walk in this field. So this is really an exciting journey. As a researcher, once you are engaged involving in this kind of research projects, then it feels like an exciting journey. So with that, I will just end this session, that research project management session. And I can understand that there are a lot of things to be covered, because it's just an overall idea about the research project cycle, we can also have a lecture series on the research project management, such as just how to write a protocol, how to write a research proposal, or how to do a grant application writing, and then how to and about the design, study design and methodology, and all, how to write a paper kind of things. So it can be a lecture series on the research project management as well. But from my experience, I have just given an example of those projects that I managed to handle and publish, and the experience that I got managing these projects. So in general, in overall, I just presented this. So if you have any questions, I can take those questions, and thank you for listening these presentations, and definitely looking forward in the future as well. If there is any opportunity comes, then definitely I am here for the future as well. Thank you, Kapil, for this opportunity.
All right, so thank you so much, Dr. Prakash Paudel, for such a wonderful session. So we have a few more questions on the YouTube, and some of the questions from our messenger box as well. So I'm going to share you. So I request you to answer one by one.
Yep.
All right. So let me share the screen. All right, so this is the question. Maybe this question is regarding the about how to get a grants or for the local researchers, or how we can apply for the different research as well as the grants from like our country, Nepal, or who are working in the beside of any central research unit.
Yeah. All right. Yes, definitely it is very important for us to get a research grant to conduct this kind of research project, because the research projects are costly. It requires lots of resources, human resources, as well as equipments, funds, travels, per diems kind of thing. So we should have that grant to conduct any research, especially that school-based or population-based research are quite costly. So in terms of looking for grants, there are many NGOs working in Nepal. Basically, those NGOs have also, they have in a different period of time throughout the year, they just announce particular research grant through their website. This is where you have to look into, like, for example, I would say in Nepal, there's Fredolus Foundations and Eye Care Foundations, Himalayan Eye Care. So they do have some of research grants projects that are often available. And the other way of approaching is to the companies as well, to the industries as well. If you are interested in contact lens research or in clinical research, then and the relevant industries such as Asiler and like Washen Lom, or these big companies do have some small scale of research grants that are often available. So you have to get that correct link and correct contact person. That is really important, so that you have to be quite well connected with those people, which you can do through LinkedIn. LinkedIn is really an important platform where you can get connected with the people all around the world. So I would say this is how we can do, because in a national level, we don't have in Nepal, we don't have such bigger fund. But I can remember that National Health Research Council, they do have some fund available every year. We can also apply for those grants, especially that those are the smaller grants. Like it can be just, if you say in dollars, then that can be just 10,000 up to 10,000, so $20,000. So that is also available in Nepal, in Health Research Council. From that institution, you can apply for research grant. Yeah, I hope I answered your questions. And
Yes, Doctor.
suggest you
Yes.
to remain in contact with the people who works in NGOs, who are in the management in the NGOs, through LinkedIn. LinkedIn is a very good platform. Please keep your eyes on LinkedIn, and there often you can get the announcement about the research project grant as well. Yes, thank you.
All right. So thank you so much, Doctor, for making us more clear. I guess these are all the feasible way to apply for the grants. All right. So I can see only the few questions. All right. So I request you, participants, if you have any question, you can drop. Dr. Prakash will be happy to answer all your queries. So we are waiting for 4 minutes, and we are also about the end of the session. So Dr. Prakash, if you have any good notes before ending the today's session.
Yes, thank you for listening this presentation, and I hope I may have fulfilled some of your expectations. But yes, in fact, getting engaged into the research projects is a big commitment. And it definitely needs good connections with the organizations that often fund for research projects. So I would just ask you to get connected with the people who often conducts research, even in the South Asian countries, that there are good institutions such as LV Prasad, Arvind. Those institutions often do big projects, epidemiological projects, as well as clinical projects. So you can keep an eye on those institutes and the researchers as well. And yes, if you are interested in any projects, particular projects, you want to learn about that projects, and if you are looking for the papers, you can just search me in ResearchGate as well as in LinkedIn. You just try to connect with me. I would definitely accept that request. And if you have any questions in future, if I have time, if I will try to just answer your questions if anything is available. From here, yes, we can keep ourselves open for any opportunities that may come in near future. So yes, I'm looking forward. Yes, thank you. Thank you, Kapil, for these opportunities to have me in these sessions, and I'm really happy to present my work and about and general impression about the research project management. Thanks, Kapil. Thanks, Kapil and Mero Eye Foundation.
Thank you so much. Thank you so much, Dr. Prakash. Thank you so much. Actually, it's our pleasure. So once again, thank you so much, all the participants, to joining us throughout the session. So we'll be coming up with the next session very soon. Or I also like to request you all that if you want to enroll on the other session or other lecture series, you can just go to the Mero Eye Academy website, and you can find all these sessions. Even you can join the live session from there. So make sure that if you want to join our Zoom live session, you can also go for the website, and you can directly find the links to join the June. So once again, thank you so much, Dr. Prakash Paudel, and we'll be definitely connecting via the WhatsApp or mail. Thank you so much.
Thank you. Bye-bye.
Bye-bye.